Thanks, Jeff, and first of all, thanks to the organisers for inviting me to present. I was driving in this morning and on the news there was another report about the state of Australia's children and the circumstances that too many of them find themselves in, and it resonates with some of these sort of numbers. I hope you can see this. So 40% of children in sole parent households live in households below 50% of the median income. I'm not telling you anything new, but I just want to remind ourselves as we think about the kind of work that we are all trying to do in various ways. There's a context, a much bigger context within which we work that affects everything that we try to do, and we don't directly change those things. But when we've got 530,000 children in Australia in income poverty, the interesting thing to me is to look at these by age groups. So that's the highest proportion of any age group. And if you look at what's happened to 65 and over, the income poverty in that group has plummeted. And rightly so. That's a good thing. But we now have 0 to 15-year-olds as the highest proportion of our population in income poverty. And then we can also think about this in terms of consumption poverty. And that's the ability to have unmet needs, things that children ought to have that they are not able to afford to consume. 600,000 children under 15 in Australia. Again, I don't need to remind you, but for me this is always the context within which we're working, this bigger picture of trying to help children have better, decent starts in life. Those disadvantages don't sit on their own, they're multiple, they cluster together, and according to this report from the Productivity Commission, 20% of children under age 15 have 2 or more of these multiple deprivations. So, my job today, in the spirit of silos being broken down or merged and collaborating, is to tell you a little bit about a resource that we have in South Australia that is exactly built on the idea of fostering collaboration. Some of you will know about this, some of you may not. My job is to try to tell you this is a collaborative resource that we have in South Australia. Other jurisdictions do not have one of these. We have the best in the country. And so it's up to us to think creatively about how we can use such assets to foster collaboration. So this is the South Australia Early Childhood Data Project. It contains every birth cohort from 1991 going forward of South Australian children. That means there's about 350,000 children, the experience of 350,000 children born in South Australia. And then whenever children come in from interstate, they might not be born here, but they come in and they go to the hospital or something and we pick them up as well. Importantly, that's 18,000 Aboriginal and Torres Strait Islander children. So for small population groups who are often invisible in research enterprises, this gives great capacity to look more closely at the experience of Aboriginal and Torres Strait Islander children. So we've got lots and lots of records. 30 million, we just stopped counting after that. The important thing is this is a public good resource. This is not my data, this is your data. You paid for this to be collected, and it's my job to figure out how we can use it better, because it's collected in silos. That's how government and other agencies collect data. We take the silos and join them up, and that's how we're able to give some idea of the experience of different groups of children where their information is linked up across those silos. So this is one small part of building a collaborative enterprise to assist us all in the work that we're trying to perform. So we are trying to add South Australian police data. That becomes particularly important when we're interested in the intersection between child maltreatment and family and domestic violence. We have almost no insight into that in Australia because those data sources are not available. Police data is the best for that, and we have to keep pushing to try to, again, link up information systems so we get a better idea of what's going on. So this is one platform, but it's got lots of purposes. So I live in a university, I live in an academic world, and universities have certain drivers. So we have traditional academic outputs. That's where I have a clever thought, I write a paper, it gets published in a journal, 4 people read it, 2 people understand it, the funder says, well done, the university says, well done, and what was the point of that? That's the academics talking to themselves. One of the things that academics have to do much, much better is start talking to outside of the academy. And so we've tried to work, I guess in the last 2 years, 90% of our work has been non-traditional academic. So we end up doing what some people call business intelligence, and a lot of that work has been in collaboration with government departments. But that's going beyond the traditional academic outputs and trying to get a handle basically on how can we do service provision better than we're currently doing it. So that partnership sort of research has involved 17 different data custodians. This is all highly encompassed in multiple ethics approvals. I should say we work in a de-identified world. So we don't know the identities of any of these children or families. They're de-identified. And we've worked with Premier and Cabinet, Child Protection, Child and Family Health, Human Services, Women's and Children's Health Network, hospitals, education, and we have a governance group that controls any use of Aboriginal and Torres Strait Islander data. That's not in our control, that's in the control of that governance group, exactly what gets used and not used. And recently, Federal Department of Social Services, we're about to get access to Centrelink data. That becomes a very powerful tool for understanding intergenerational inequality. And importantly, we work with NGOs and a couple in particular. And I suppose that's what I really want to get across today, and I'm going to say more about it. But the context within which you work, we would like to try to think of ways, creative ways, that this resource can help you do your jobs better. And one of those ways, I think, is in terms of trying to have a better lens on evaluating what works in terms of what you do. So that's a challenge for all of us. But the first point is to make everybody aware that this resource exists in South Australia. So as I said, in the last 2 years, we've done a lot of stuff that is within government, and it's confidential within government now. There's about 35 different research briefs on lots of different things. A couple of those are public. So I want to give you some examples, and the examples that I'm going to talk about are largely in the child protection, child maltreatment area. That's become a focus for us. That's partly because child protection data has often been very closely held in Australia, not just in South Australia. It's not been sort of opened up to have light shone upon what's going on. So we've been fortunate working with the Department for Child Protection to have access to pretty much all of their data now. And so we work very closely with them trying to better understand how we can shift the game in child protection. And actually Leonie's going to be talking about that more this afternoon. She's working in a similar sort of way to the way we are. So, child protection system contact, a child-centred view. Why do I say a child-centred view? Because like all siloed systems, if you think about a hospital, it collects hospitalisations, it collects events, it collects activities, because that's how it gets paid. We get paid by the number of things we do. So the hospital has no idea whether these 10 admissions are from one child or from 10 different children. Now I'm overstating that a bit, they sort of do. But the actual information system doesn't, because it counts activity. What we do when we link up information is we can turn that activity into the experience of a child. So we can tell whether it's 10 different children or whether it's the same child 10 times. That's what's important about this ability to link data up, because the siloed systems can't do that. They can only count activity within the silo. So if you average it out over these birth cohorts that we've got over from 1991, there's about 20,000 births in South Australia every year. So by age 10, so what I want you to think about is we have each year, there's 20,000 children born, and we follow them through until they reach age 10. And then we count up the child protection experiences of that entire birth cohort. Does that make sense? So we're following them through to age 10. Out of that 20,000 births, about 4,700 children will receive a child protection notification. That's 25%. That's 1 in 4. That's the 1 in 4 number that the previous government released after the Nyland Commission. So the first thing to recognise here is notification to child protection is not rare. This is a very large problem. It's a massive problem. That's twice the prevalence of childhood asthma. So you think about the scale of that and how we're going to deal with that. That's a public health problem, just purely in terms of its scale. So of those 4,700 children, about 19% of the total will be screened in, 10% investigated, 5% substantiated, and just under 2% will experience at least one episode of out-of-home care. So I'm a public health epidemiologist. The first thing I notice with this is, well, of the 4,700 children, 1,364 are not screened in. 1,649 are not investigated. 829 are not substantiated. That basically means the child protection system doesn't do anything. So of the 4,700 children, about 80% receive no service from child protection. That means they're just going back out into those same circumstances that generated the notifications in the first place. That is a massive opportunity for prevention. We can use that information and we can try and support those kids and those families. So these are a couple of the actual published reports. You can find this on our website if you want to go and have a look. And a lot of the numbers that I'm going to show you appear in that one on your right, the child protection in South Australia. So let's start digging into this a little bit deeper. So of these children who are known to child protection, one of the things we want to know is what's the age pattern for this. So we're interested in under age 5 because that's when kids enter school. So this is before they're entering the formal education system. So of all of the notifications, just over 50% will occur under age 5, 55% of the screenings, 64% of investigations, 60% of substantiation, 69% of out-of-home care. So if you're in the child protection business, half of it is under age 5. And that immediately has implications for who's the workforce that's there under age 5 supporting these families. In the early part of life, that's largely the health system. Then we have childcare and we have preschools. So we start to think about what are the agencies with feet on the ground that can help in this prevention effort. So the implications, especially for the health system, are important to think through, and I'll show you some of the work we've done with child and family health. So, key message to walk away with, child maltreatment is common. I did not believe this number when we first did it. I said that cannot be right. It's too big. It's not. It is correct. So 25% by age 10 in each birth cohort will have a notification, and half of that's under age 5. What about re-notifications to child protection? So we've looked at this a little bit. So these are times notified by age 5 if you were notified under 1 and then under 2. So if you look here, the bottom line is about 35% of children who were first notified under age 1 will have 5 or more re-notifications by age 5. In other words, there's a lot of churn through the system. I see people who work at the coalface nodding, and I apologise for telling you things you already know. But part of what we do is try to tell stories with numbers. That's not the only way to tell stories. There are many, many better ways to tell some of these stories. But our contribution is to try to tell some stories with numbers and find the right numbers that people can sort of go, gee, that seems a lot. So there is multiple re-notifications to child protection, regardless of the initial response by the child protection system. Let's take a look at out-of-home care. So this is out-of-home care patterns by year. Yeah, this is a terrible slide. This is where I say, I don't intend for you to read this. And that's where you rightly say, then why the hell did you put it up there? So let's just get the message. So you can see this as age down the bottom. These different coloured bars are just different birth years, birth cohorts. So here's the story. Out-of-home care for under ones hasn't changed much from 1999 to 2013, age 3, even at age 10. So the story here is the proportion of all children entering care has not substantially changed over time. Some of you will see AHW reports that says it has. That's because they can only count notifications and they can't count experience of the children. What has changed is if we look at guardianship orders for 12 months, they've gone up a little bit over time, 1999 to 2013. So they've gone up, increased over time. If we look at guardianship orders for 18, then we have massive changes from 1999 to 2013 at all ages. So the proportion of all children experience guardianship 18 orders has increased over time. The key message is children are going into care for longer periods of time, and the fastest growing segment is guardianship 18 orders at very young ages. And that probably reflects changing culture and willingness to intervene earlier to try to take kids out of very undesirable circumstances. So the other thing we can do with this is to look at what happens to these children. So we can trace the children's experience through child protection and then later into school or into some of you will be aware of the AEDC, the Australian Early Development Census that we get every 3 years on all the 5-year-olds. And that's what we're using here. So this is children who've had no contact with child protection. The great thing about a whole of population database is you get to see the children who don't hit your system. And unless you can see the ones who don't, it's very difficult to interpret only the ones that you do see. So these are the children who've never had a contact with child protection. Here, they've had at least one notification but not screened in, at least one screen in, at least one investigation, no substantiation, at least a substantiation but no out-of-home care, and one or more out-of-home care. So this, if you like, is more severe progress through the child protection system. And then what we see is this is developmental vulnerability. So for children who've never had contact in South Australia, there's 17.7% of those children are developmentally vulnerable at age 5 on one or more of the AEDC domains. You can see here, for these children who've progressed into the more serious end of the child protection system, where over 50% of those children are developmentally vulnerable at age 5. These poorer starts in life we know are very difficult to overcome, but they're evident very early. These children aren't even in school yet. The other thing to look at is this group. So this is the group that's just had one or more notification and nothing more serious. So there are some people who believe that all of these notifications are false positives. These are children who are being reported because they don't have the right piece of fruit in their lunchbox at school or something. So there will be some of those false positives, but what this shows is that on average, these children who've only ever had at least one notification and nothing more serious, they are twice the level of developmental vulnerability than the children who've never had contact. So on average, there's something going on with those kids. People are notifying, and on average, those children are not doing well. So the idea that we can dismiss these notifications as being false positives is just empirically not correct. Okay. The other thing we've tried to do is inform service delivery and work with operational agencies who can support prevention programs and do more to stop children getting into the child protection system and especially progressing through it. So this is the Nyland Commission report, and on the basis of that, the Child and Family Health Service started a new model of care. That new model of care is now being rolled out, and in that new model of care, we used the data platform in South Australia to help inform ideas of vulnerability and risk. So these are sort of high risk, target and sustained, universal. This is the new model of care. But this is the number of kind of adversities that children could expect to face. So about 27% of the South Australian population will have a set of risk factors that might make them eligible for a more targeted and sustained program of contact from the Child and Family Health Service. If we look at the Aboriginal population in South Australia, that group's about 64%. And that's because of all of the background characteristics that those communities carry in terms of multiple intergenerational disadvantages. So we've used that to try to say to Child and Family Health, where should you be putting your resources for more targeted and sustained programs? So this is real data, but obviously it's anonymised now. This is in one area of South Australia with these small areas A through I. And here we've got the number of births, etc., child protection, contact, and these risk factors. The bottom line here is we can look in area A, and we can expect, based on the risk factor profiles, that about 65% of the births there will be low risk and only need universal services. With me so far? But we can also say that in area B, that proportion's much lower. About only 23% of the births in that area will be lower risk, and over 64% will require targeted and sustained services. So what does that mean? That means Child and Family Health have reallocated resources and FTE based on this work. This is not rocket science, is it? If you're going to need more resources over here, let's put resources over here. Often that's not the way the money gets spent. So we're trying to help inform Child and Family Health have a better evidence-based reason for allocating the resources the way they do. So this is a novel linked data platform. As I said, other jurisdictions don't have one of these. They certainly don't have one as rich and powerful as what we've got, and that's a natural advantage for us here in South Australia. You work very closely with agencies, such as various government agencies, but presumably we could be also working with the non-government sector and community-based sector in exactly the same way. Because like I said, this is your data. That can inform evidence-based models of care, and that can actually result in resource reallocation. So there's a direct line of sight from a new information system that is collaborative in nature because it links up information to actually changing the way services get delivered. Now, that only took us 3 years working with CAFs. These things don't change quickly, but we've got a basis for that change, and through greater collaboration, I think we can push this agenda forward much faster than 3-year timeframes. So the potential for prevention. Let's talk about some at-risk populations. One of the things that economists love to do is try to identify cohorts that are high risk. So in this case, they asked us to look at young mums. So in the whole population, maternal age, young maternal age, that's under 20, That's only 4% of all births in South Australia. In disadvantaged areas, that might be up to 10%. So for every 100 first-time mothers aged younger than 20, 5 had at least one child placed in out-of-home care. Not very many. So if we think about all the births to young mums, 95% of them are going to be doing just fine. If we look the other way, and we look at the children who are in out-of-home care, and then we look back at the mother's age, then we see that of all the children in out-of-home care, 57.5% were born to a mother whose first child was born under 20. So it's a bit paradoxical. In the whole population, 95% of children born to young mums are just fine. But if we look at the out-of-home care population and look backwards, then nearly 60% of the children in out-of-home care are born to mums who had their first child under 20. And I just said that. So if we look at those young mums, there's 644 young mums with 1,180 children in the data. 67% of these mothers had their own child protection experience. And again, everyone's nodding. You know this stuff because you work on the ground. So we're looking at almost 70% of the children in out-of-home care are actually an intergenerational process through the child protection system. So, the other thing is we can work with agencies that don't think of themselves as being in the business of child health and well-being. The average client for Housing SA is a single middle-aged female. That's the core of their business in Housing SA. So, let's ask, children known to Housing SA in our data, how many were known to child protection as well? So of all the children known to Housing SA, 44.8% were also known to child protection. That's a big overlap between those two populations. Let's go the other way around. Of all the children known to child protection, 55.5% were known to Housing SA. Big overlaps in these populations. And over half of all the children known to child protection, also known to Housing SA, but 40% of them were known to Housing SA first. So does that make Housing SA a lead agency in child protection? That's certainly what they're starting to think. They go, when we presented this data to them, they went, wow, we didn't know that. Because they don't think of themselves in that space. So these are other opportunities for collaboration that come from these stories we can tell with numbers. All right, so everybody's talked about a public health approach to child protection. We all think, yes, that's a terrific idea. What does it mean? Well, we're a bit light on the details. So let's have a talk about that. So that's a prevention system for child protection. In practice is not well articulated, despite the number of people saying we need one. And because I'm a public health person, you would think that I'd have all the answers, which of course I do not, because we'll need to co-design this. What does a prevention system look like for child maltreatment? We'll have to all work together to figure out what that looks like. So here's the progression through the child protection system from being notified through to out-of-home care. This will involve statutory child protection responses. Child protection system is under statutory responsibility to take care of the highest risk children. This will require broader system responses. What do we mean by broader system responses? Well, we keep saying child protection's everyone's business. Well, what is the child protection system or the potential child protection system? We started to map this out. And here, again, here's another one of these slides that you can't read, and you should say, well, stop putting them up. So we see child protection in here in the middle. And these are agencies that have a child and family focused service responsibility. So we'll see the antenatal system, here the postnatal, we can see children's centres, child wellbeing practitioners, childcare and preschool, all the way down these CAMs, primary care. We haven't talked much about the role of general practice and primary care and Aboriginal community-controlled services. So these agencies refer into child protection, but they also have their own child and family-focused service responsibilities. One of the issues is, can that role be expanded? And that's what CAFS is doing right now. They're taking a deliberate view that the way they do business, it can't just be about feeding, sleeping and settling anymore. We need to do more than that. And that has workforce training implications. But we need to think across the whole system in terms of upskilling and retraining. And then on the other side, there are agencies that are related but don't have a particular focus on child and family services. And that's where places like Housing SA would fit. And indeed, corrections, police and courts and Centrelink. So there's a potential here across all of these agencies, and if protecting children's everyone's business, then we're going to have to work across some kind of system map like that and look for leverage points where everybody can start to do better. And that doesn't even include the community-controlled and non-government sector yet. So in South Australia, we've got at least 10 government agencies that already have a child and family-focused service provision. What are we going to do with that? Nobody knows what to do with that, and the solution to that will be local. We will have to develop this ourselves, and we can do that. All right, so we've got a big data and evaluation platform, and it's sitting right here. Now, big data, you'll see this stuff all the time. Big data gets a bad name, doesn't it? Because there are people out there like this. Remember this lot? Cambridge Analytica that fiddled the US elections and did all those nasty things. This is big data that is meant for public good. And a lot of what's sort of driving behaviour in the sector is inspired by some of the work in New Zealand. You've all heard of social investment approach, collective impact, all of these things, all of these terms are kind of coming from the same place, where all sorts of government spend is asking to be better evaluated, evidence-based programs, etc., etc. So I'll skip that one. Behavioural insights in New South Wales. It's getting pretty tough to win a government tender in New South Wales for social services unless you're willing to run a randomised control trial. And you can see that in some of the tenders that are coming out. If you're not in the land of a randomised trial to offer a new service, you're not going to be competitive. I think that's the pendulum swung way too far there. But what I'm trying to get at are there are drivers in the system that we might be able to harness, and I'll get us to that point in a second. You have in the Australian government the behavioural economics team. That's all about trying to figure out how to evaluate what works in more rigorous ways. You're telling me 5 minutes. I'm getting us back on time here, mate. I'll be done, don't worry. This is a context within which we're working. Some of you would be aware of the DSS data exchange framework. What are we trying to do there? That's the federal government trying to move from what they call outputs to outcomes. Outputs are about counting activity. Outcomes, did it work? I don't think that push is going to go away anytime soon, and non-government organisations as well as government organisations will be under greater scrutiny to generate as good evidence as they can about the effectiveness of what it is they do in terms of trying to support these families and children. So how will we know what works? That's going to be a question that will undergird everything that all of us try to do. So this is something that I put together for a couple of years ago for an AFES conference about what can early interventions really achieve and how will we know. So one of the challenges for people like me in the research game is if you look across the quality of the evidence we have, 50% of it's not very good. Now, I know you think everybody with a PhD must be brilliant. It ain't true. If half of the research we've got is actually not well evidence-based, then how do we start to move collaboratively toward a better evidence base? That means researchers working with folks like you to get better evidence that's generated from the ground up. So you might have heard of evidence-based practice. Well, actually what we need is practice-based evidence. We need to switch that on its head. Okay, and I've been pushing the idea of good enough evidence. We will never have the money, the resources, the time, the people to run randomized control trials of everything we think can help families. That is not going to happen. We should reserve, they're very expensive to run, they're very hard to do. We should reserve those for when we think we've got something really special that works. So what are we going to have for good enough evidence? Well, that's going to come from data platforms like the ones we hold, where we can see people who don't get a program and we can see people who do. And there are these things called quasi-experimental evaluations, where we create a comparison group. The biggest problem you have in figuring out what works is, who do you compare to? Because you only see the people who touch your programs, and you do a pre and post. But what about the comparison group? When we get a comparison group, then we're starting to build higher quality evidence. And so the advantage of what we have in South Australia is we've got the comparison groups. They're sitting there. We just have to find a group that looks like the families and the children that you support. We find another group who looks just like them, but was not involved in your program, and we've got an outcome that we care about that's being measured. Then we're actually in a pretty good space scientifically to compare those outcomes. And that's what I mean by good enough evidence. By all means, let's run the trials when we can, but we'll never be able to do all of those. So this is what we've got in South Australia. We've got an information and evaluation platform. These are the big data platforms down here, the ones I talked about, where we've got linked data from the jurisdictions. We bring federal government data in like PBS and MBS and AEDC, and even local data, where we're working with agencies like Taxi who are going to bring their data into this platform. And that's all linked up. We can see the same child and family in all three of those platforms. And that's where the world of big data analytics sit. But perhaps even more importantly, we've got an evaluation and innovation platform sitting there. So in here, if we know who gets a service, and we can document that, and we know who doesn't, then we can use these quasi-experimental techniques to evaluate the outcome differences between the groups. And then we do that because those children and families also appear in the bottom. When we've got a really good RCT idea, we'll run a pragmatic trial. That means a trial not in research land, but in the real world, and we'll design a trial. And we've done a couple of those with Child and Family Health Service. So somebody gets the program, this time it's randomised to not get it, and then we can evaluate, did it work? And that's the platform that allows us to test innovations. So all of our work is around trying to contribute to the intergenerational, breaking the links between intergenerational disadvantage and getting those kids who are born into these disadvantaged circumstances, and there's way too many of them, just trying to tip them up onto better tracks. So I hope that the rest of the deliberations today, and if you've got any great ideas for how we might work together and collaborate, then please get in touch. We're easy to find. We're just over there in that big building. So thank you very much.